The aged care sector has met to discuss the challenges of implementing Commonwealth reforms which aim to double the number of older Australians being cared for at home. Australia's Age Discrimination Commissioner has told a conference in Adelaide the changes will present unique challenges to carers.
In the biggest aged care shake-up in decades, more carers will be going into homes than ever before to take pressure off aged care facilities as Australia's population ages. A national conference in Adelaide has been told that carers will need specialist training to cope with the change.
They're going to need all sorts of training, but they're particularly going to need, in my view, training in the human rights aspect of what they're doing.
The Commissioner says funds are needed to educate carers on how to deal with the diversity in culture, religion and sexual identity of their clients.
Now, if people are living in their home in their way and the carer comes in, the carer needs to be able to recognise and respect that diversity.
One key aged care organisation supports the reform but says the government needs to provide more detail.
Community care costs a lot of money. Residential care costs a lot of money. For our members to plan that sensibly, we need a very good, clear understanding of how those reforms are going to be implemented.
Susan Ryan also says age discrimination in the workforce is increasing, with 44% more complaints to the Human Rights Commission in the past year. She says 2 million people over 55 years old can't find work because of their age, putting a $10 billion strain on the public purse.
It doesn't have to be this way. We have to get a change in employer attitudes. We have to get rid of the deep-seated age prejudice that I think is throughout our community.
The government's new aged care scheme will be rolled out from the 1st of July. Kim Robertson, ABC News, Adelaide.